So where I am now from where I started with endometrial cancer, which was misdiagnosed for approximately 4 or 5 months, is that it's having had lots of different treatments, it's now gone into my stomach, and what that means is that, well, you can probably hear it, there's nowhere for it to escape, so there's a complete blockage in my stomach. It's gone into the stomach cavity, and what that means is now I can't process food at all. You waste away. As you can see, the cancer's living off my arms now and off my legs. It's the only really thing that's surviving very well. It's thriving like a fungus really on a tree, and it gets into your stomach so that you can't process food. So if you're a fighter, your chemicals still want to have breakfast, still want to have lunch, so all your digestive juices want to work, but they've nothing to work on, so you end up with a build-up of acid which burns your stomach internally, causing gas, which is very uncomfortable and has nowhere to go, and you want to eat. So there are 2 solutions to that. The medical solution is to put a tube down your nose, which impairs your breathing because it presses on your chest when you like this, and what happens is you don't get any respite really. It just lets the gas come off, but the acid remains in your stomach, and so the only way to relieve it is to eat a very small amount of food and then to vomit on a daily basis. The vomit is mostly bile, and your choices are then to stay on a drip. Well, you're not given a choice, that's the point. You are dying of starvation. I'm actually dying of starvation because I can't process food. So the drip is keeping me alive, at which point I think we have to raise the question in cancer, whose life is it anyway, a bit like the film of many years ago in the 70s. My quality of life is, if I want to eat, I'll give you an example of what I do. Because the gases in my stomach build up, and all they can do is put that tube in to take the gas and acid off, but doesn't solve the problem, and it doesn't help you breathe. You struggle to breathe. For quality of life, in my last few days, this is what I do. I eat a little to get the juices to have something to work on that are stuck. And then I spit out my food. Afterwards, I'll be sick, and that is my quality of life. I can't have a nice glass of wine, isn't that such a shame?
It is a shame.
Or a glass of champagne, even at this point, to say goodbye to my friends who have been so kind to me. I wouldn't have lasted this long if it hadn't have been for my good friends. Julian and Diana, Carol and Roland, Jackie and you here today, Adele, with Nick. Thank you. The reason I'm doing this video is not because there's anything can be done for me. I just want to do it for other people so they don't go through it. The point of this is that I don't want anybody else to go through this, because it's unnecessary if the signs are seen soon, and in my case they weren't. So beware if you're a strident female at say 49 who was bullheaded like me and striding out there, getting on with your life, busy, doing lots of things, as so many women are, leading very fruitful lives. The first signs I was getting tired would be really towards the end of 2014. I enjoyed walking, healthy lifestyle, loved exercise, loved salads, good fruit and vegetables, healthy diet. And it was out when I was walking with my dog and my father that I first noticed feeling fatigued after a short walk. I thought because it was coming to the end of the year I was in need of a rest. But I was just curled up on the sofa quite a lot, I found, near that Christmas time, feeling just tired a lot more than in the afternoon. I thought maybe I drank a bit too much wine at Christmas, but it turned out not. And then in the spring, I began to, the signs you get of endometrial cancer in the beginning are swelling in the midriff, and you assume it's your midlife crisis coming on, that you're beginning to put on weight, but actually it's the body responding to a carcinoma in your womb. The carcinoma is very small, it's like a little marble, and it sets up shop just like an unwanted alien in there, and it's very aggressive. So what happens is that the carcinoma remains undetected because you can't feel it. You just feel a little bit tired, but you drink more coffee, you maybe go to bed earlier, you push yourself more, and then you go to see the doctor, and because you start bleeding abnormally. If they're a good doctor, they get it, but unfortunately many doctors, it is a fact worldwide, they call this the silent killer. It is undetected because at 49, 50, they assume, as my doctor did, I needed HRT. That is like adding a firework to the situation when you have endometrial cancer. If any doctor says this to you, don't take that as the first opinion, please. You may be fortunate. It may not be that. It may be you do need HRT, but the downside is this is where it can lead to in cancers. It's a very, very aggressive cancer. The outside prognosis, if it's caught early, is 5 years, and much less than that if it starts on you. Now, the signs are very, very heavy period, but then you get what can only be described as, and I'm a doctor in another field, but not this field, like little bean shoots coming out that would look very, very odd indeed, like a sci-fi movie. And the bed is absolutely saturated, as though you'd had a miscarriage or something. And after that, I went to see a gynecologist who misdiagnosed, and you can feel inside your own womb growths like stalactites coming down. So if you wear tampons, you can't get the tampon in. But despite that, my first gynecologist didn't even recognise that. He did an internal examination and told me I was completely normal, even though I had growths coming down like pieces of coral that felt abnormal to me and couldn't keep a Tampax in. He then said I needed my womb scraping. This is very, very important. Don't ever listen to that. Get a second opinion, because what he did, my cancer, because I had a good fighter cells in my body, my cancer was being contained at this point inside the uterus. It hadn't metastasized. but he misdiagnosed it and scraped the inside of my womb. This is like sending an incendiary device into a malignant area, and at that point it started to spread through my blood system, and within a week or so it was in all of my lymph nodes, down my spine, in my neck, in the subclavicular region here. It went around my kidneys very rapidly. The speed is the thing we have to look at here. It goes around your kidneys, vital organs. I didn't ask to see the scans later, but it was then too late to do surgery. I had asked for a hysterectomy when I felt unwell, but I was denied that, which would have taken the problem out. The thing is, when it went into all my lymph nodes, they then misdiagnosed that at the same place. And what happened was they told me I'd got a cancer that belongs to 80-year-olds and nothing to do with my stomach. This was some sort of a cover-up, because what they'd found in my womb on the scrape out was the small carcinoma that is in fact the beginnings of very aggressive endometrial cancer. That's the silver bullet. So I then got the phone book out and I just started ringing numbers. Doctor in Harley Street saw me at 5 to 8 in the morning on a bank holiday weekend. That's how dedicated a man is. And within minutes told me what had happened. He was also visibly livid at what had happened, because he's been trying to raise awareness of these cancers in women, and he sent a very stringent letter, if that's the right word. I wouldn't use harsh because he's too much of a professional, but he sent a very strong letter to the previous doctors explaining how they had missed it and the consequences of that, and where I was now at, and how dangerous it is for women to have it missed for so long. So he then contacted a very brilliant oncologist in London, who became my oncologist, and together they tried to save my life. It started with aggressive chemotherapy, where I was on chemotherapy from May of that year through to August in 2016, where I was on very heavy duty chemotherapy, which I responded to beautifully. It was textbook, and there is hope. It all came away. I then, at that point, wanted to have my uterus removed because it had gone from all my body. It was a miracle. But conventional science says that if you take these kinds of cancers out at source of where it started, there's always the possibility it can come out somewhere else in your body very awkwardly, for example, your lungs. So conventional medicine is, I guess, divided here, but conventional medicine is leave it in, then it won't come back in a difficult area that's easier to treat. Unfortunately, it did come back again in the uterus, and we had to start aggressive radiotherapy. The plan for my radiotherapy was drawn up immaculately by Dr. Park, but it is my belief, from an experience I had in the radiotherapy chamber on one occasion, that the beam was not aligned properly, because there was not two people, only one, and the beam appeared to me to be higher than the bisector point. At this point, I began with terrible problems in my stomach that were beyond radiotherapy after effects, and my eating problems began. That was 9 months ago in the November. I then started having difficulty eating and was throwing up a lot. There is a normal effect after radiotherapy, but mine was a very intensive reaction. And then I began to lose weight. They thought the problem was damage to the bowel, which can happen, unfortunately, in the best of radiotherapy plans. But there was some complications began to occur. So I was in and out of hospital then for a period of 9 months in total, all to do with not being able to eat properly. And then, of course, we discovered that the inflammation had then turned to cancer in my bowel, and then it travelled into my stomach, and then it closes off your digestive system. And I'm now going to talk a little bit about the lack of connectivity between different schools of thought in cancer today. If you do suffer cancer like this, before you go in for chemotherapy, there's now conventional wisdom that says to stop the burn on your system, you should really be having probiotic yogurt prior to each session. To stop the burn and help your digestive system. Nobody tells you this. If you have sustained radiotherapy burns, after radiotherapy, it's now been proven that you can get hyperbaric oxygen chamber therapy. This was what they used to divers for developing problems with the bends to correct it, and they've now found that under compression chambers with increased oxygen, the cells in your gut can regenerate after radiotherapy burns, in which case a lot of these symptoms can disappear. Again, I did this and tried it, but it wasn't enough in my case. A simple therapy like honey and tepid water can coat the bowel and help it heal. Beetroot juice, if you're constipated through therapy, can line the bowel and help you go to the loo. Twice they told me that my bowel was finished after radiotherapy, that it was so fragile they couldn't operate. But I got it to work again using beetroot juice and a very low residue diet. There are also other alternatives available in the world to help you battle chemo while you're going through it. For example, in Germany, well established for over 20 years now, is mistletoe therapy. And you think, mistletoe therapy, what's that? Sounds so funny, we associate it with Christmas. But mistletoe therapy is an evolving therapy. It's an ancient therapy, much like garlic is an antiseptic. It can actually heighten your immune system. Unfortunately, I found that treatment too late. I was responding to it very well, but I got it too late and I'm now no longer responding to it. But in Germany, they have found that it can increase your reaction to chemo, therefore fighting cancer by up to 50% odd. So it's very useful to know. Does diet have a role to play in endometrial cancer? This brings us back to what I was saying earlier. I think more than diet, I think that possibly, unfortunately, the pill may have something to do with it. I was part of a first generation user of a pill called Dianet. Dianet was a mixture of ciprotrone acetate, progesterone and so on, and it was used when I was suffering at 18 for acne, as though that's the problem now. When you get to a certain age, and found a certain age, I wouldn't be bothered now. But when I was a kid, it was getting on my nerves and I was getting a bit bullied with it. So I tried tetracycline, which clears the skin, but then I went on to that one pill. But so agreeable was it with me that I stayed on it for a lot of my life. But the trials are, there are really no long-term trials of what that might do. One of the effects of Dianet is to thicken the womb lining, and that is the only thing, as I didn't fit the medical profile for an endometrial cancer patient, that I can say to strong, fit and healthy women, look at your pill and maybe, even though it's convenient, maybe think again, because we're going through periods where we're only just beginning to see some of the effects of those new generation pills. As I say, I would be the first generation, and maybe I overdid it. Maybe I should have come off it a long time before I did, but because it was something I'd always taken. But I did notice when I tried to come off it that my problems started. For example, I went bald with it as well, so it obviously had affected my biochemistry in some way, and maybe there's some things, I'm not blaming it on that, but I think we need to look at some of these things in more detail. There are two types of endometrial cancer, 1 and 2. One of them responds to immunotherapy. It's in its early days yet, but may respond. And another to what's called Provarin, which is a hormonal drug. I haven't actually tried that because I was hoping to try and do more chemo, but I don't know how that would work. My advice is, as I said, we all feel like superwoman in our lives, especially when we're at our prime. And I'm a bull-headed Irish woman, so I tend to march on even when I was feeling tired, and I really should have gone and been more strident with the doctors, rather than perhaps accepting what I wanted to hear, which was a quick solution to my tiredness, and also be more strident. It's funny, isn't it, when you're a woman still, even in this day and age, if you're a strident woman, they call you aggressive. If you're a strident man, they just call you strident. I don't know how many days I've got left, but I wish every woman every success in their life in the world, in all that you're doing. Good luck, and listen to what I'm saying so that you'll be safe and live a longer, happier life. Thank you.